The Health Policy Monitor is an international network of experts from 20 industrialised nations, initiated and driven by Germany's Bertelsmann Foundation.
We found a niche. We felt that health policy was a neglected area, not really well covered by those who do health economics and look at the numbers, and those who do epidemiology and again look at the numbers. And there was this missing link.
The network looks at the forces driving health policy and the windows of opportunity for reform. It produces regular updates online and in print, and it meets once a year, this time in Poland's famous city of Krakow, home to one of the oldest universities in Europe.
The meeting is the secret of the network. It's about the really hot issues in health policy, and then we have in-depth panel discussions or debates on that.
There's an awful lot of work that's going on in comparative effectiveness around the world.
This morning's panel is about the comparative effectiveness approach to assessing the value of new therapies and technologies, featuring network presentations from Australia, Germany, Israel and France.
Well, normally you don't have this opportunity to talk about so many different countries about a common issue. So today we talked about comparative effectiveness and really to see the differences. Now I've written about these things, but to really see the differences that are ongoing and how they are making these changes, you really have to be there in the same room at the same time and comparing ideas.
If you can pay more, why not?
Since its beginning in 2002, Meng Kin Lim has been a member of the International Network for Health Policy and Reform, which he says can offer a deeper behind-the-scenes analysis.
A lot of us are intimately connected with the healthcare systems of our countries. And sometimes what we know is more than what the average layperson knows, or what we know is more than what meets the eye when one reads an official report. So it is at that deeper level of sharing, I think, that we get extra value from a gathering like this.
Twice a year, network partners from around the world report on policy developments in their health systems and good practices. The results appear in the Health Policy Monitor, a free online database containing more than 900 reports. They're also published in regular overviews and updates, serving as sources for policy advisors, researchers and journalists around the world. Key themes include care coordination and integration, sustainable financing, and responsiveness and patient-centred care.
Well, this is about healthcare reform. And really, coming from Singapore, I want to learn about other countries and so on, but most of all, I want to learn what works and what doesn't work. And I think if the key to healthcare reform is to find out from others what works and what doesn't, then evaluation is really so important.
Evaluation is another key interest of the network. One example being a report from France on its high-profile 5-year cancer plan. A rigorous evaluation found it difficult to assess the cancer plan's outcomes and costs, but noted the plan had helped to improve prevention activities.
Evaluation is so important because it enhances public trust, the population's trust in their representatives. So it has to do with the legitimacy of a policy or policy makers.
While the 20 nations in the network have very different health systems, they all face the same challenge, providing efficient, fair and high-quality healthcare at a reasonable cost.
I'm going to be going back to Washington, to the Institute of Medicine, to talk to them about what can we do about cost containment and what do we learn about it from other countries. So I will be using work from this meeting and other meetings like this to say to the U.S. policymakers, these are the interventions.
There's not enough of such forums where people come from so many countries to address issues of common concern and to compare notes and, in a sense, spur each other on to return to our countries and try to influence change for the better in our own healthcare systems.